This is Susan Luchas with debugyourhealth.com. How did we cure my husband's phimosis at home and without surgery? That's what I'm here to tell you today. I want you to note that I am a PhD, but I am not a medical doctor. Our phimosis cure has not been put to clinical trial. It is brand new. It is nowhere to be found on the internet or anywhere that I know of, which is why we're sharing it. None of the urologists know about it. It's not been published anywhere, but we think that putting out a video and putting out the content for free is hopefully going to help the most people. So let's get on with it, with all of those disclaimers. First off, my husband had phimosis. He thought it was a fungal infection. He treated it with antifungals, namely tea tree oil, and it just got worse and worse. The phimosis was a white phimotic ring, pretty thick. He was unable to retract the foreskin, and he was in a lot of pain. The tip of the penis also started becoming red and sort of irritated and maybe not infected, but irritated and painful. He was in a lot of pain. He couldn't retract the foreskin, and the phimotic ring was white and thick. So that's the situation I was dealt with when he finally came and asked for help. And we used our debugging skills to figure out what would help him. And the next video, there's another video on YouTube saying how we figured it out, our phimosis cure and how we figured it out. You can check out that video for the details of how we figured all of this out. But let's get on to what worked for him. So he was testing the best on Banderol initially, which is an anti-microbial in the Cowden protocols sold by Nutrimetics. Note that I don't work for them. I don't endorse their product. But we tested a bunch of antimicrobials, we tested a bunch of antibiotics, we tested a bunch of antifungals, and this one was the one that was testing the best for him. So it's Banderol. And the other thing that was testing really well for him was ozone. So I have my O3 Pure fruit and vegetable washer. Again, I don't work for this company. I don't endorse their products, but this stuff was testing the best along with the Banderol. So his treatment ended up being a bag, what I call a bag ozone treatment for 15 minutes, 2 times a day, followed by a topical application of Banderol. So what he did is we turned the ozonator on for 15 minutes. The ozonator and ozone went in one end of the bag, and his penis and foreskin went in the other end of the bag, and he just kind of sat there for 15 minutes ozonating the area. Ozone is well known to get rid of all kinds of bacteria and viruses and things like that. And after he finished his 15 minutes, he applied Banderol topically, and he did that twice a day. He did that for a total of 3 days. After the 3 days, Banderol wasn't testing as well anymore, and Inula was testing well. This is another antimicrobial from the Cowden Nutrimetics line. So he continued for another 7 days on the ozone twice a day for 15 minutes, and then followed by the topical application of Inula. So he continued that for 7 days. That brought us 3 days of Banderol with ozone and 7 days of Inula with ozone, brought us to day 10. At day 10, he was pretty much out of pain. The phimotic ring was gone. The skin looked normal. In other words, the white phimotic ring actually went into just a pretty pink skin on the foreskin, and the tip of the penis was also no longer red, and it was no longer irritated. However, the ring, which was now pink, was still pretty tight, and he was completely out of pain, but it was still really tight. The foreskin was still really tight. So then we started looking at what phimotic creams could maybe help stretch out that foreskin. And when he originally got phimosis, we went to 2 top urologists in the Bay Area. They both recommended a prescription steroid cream, which we did fill. I asked them why the steroid cream would work, and they said they didn't know why it would work. They just said sometimes it works. So not a really convincing answer there for me. So I wasn't sure if this was going to help stretched the skin back out now that the infection was gone, or if some other cream or lubricant that I had in the house might help. So what I did is I tested him on a bunch of things, and I rank on the website debugyourhealth.com under Phimosis. I rank the creams and what tested the best. So what tested the best was the calendula oil. This is just calendula oil from Whole Foods. This tested the best. Number 2 in line was jojoba oil, again just from Whole Foods. And number 3 in line was the steroid cream that the urologist had prescribed. So because this was testing number 3, we actually didn't do it. We did the number 1. So he did the calendula oil, and he did a bag ozone treatment again for 15 minutes twice a day, followed by calendula oil this time. So the ozone was, he was still testing well on the ozone, so the ozone was just to make sure we really got that infection out completely, even though the skin looked normal, and followed by the calendula oil to help stretch the skin back. He did that for another 4 days, so that brings us to day 14. And by day 14, the ring had widened. The skin, it was no longer a ring, actually. It was the pink skin where the ring had been, had widened enough that he could comfortably retract the foreskin and comfortably function. So it took a total of 14 days. We used anti-microbials, we used ozone, and we used what I call a phimotic cream, or a cream which was actually calendula oil. Now the question is, how in the world did I figure this out? And that's what the next video is about. There's another video called Phimosis Cure, How We Figured It Out. And you can check that video out if you want to see how we figured it out. I can't guarantee that this treatment will work for everybody, but it is a relatively inexpensive treatment that you can do at home. It worked for him without surgery. He didn't have to have any cutting or slits or circumcision or anything like that. So this is a relatively inexpensive at-home treatment. And if you check out the video How We Figured It Out, you may want to test some of your own things at home, test some antibiotics, test some antifungals, test different things, and maybe your solution comes out slightly different. But I want to give our solution and our cure out there because it did work, and maybe you can modify some of this or use it directly as is. Maybe it'll work for you, maybe it won't. We haven't put this to clinical trial. We don't work for a pharmaceutical company. We don't have funds to do that. Maybe someday we will. But we wanted to put out our cure because it's pretty new and relatively cheap and easy to do at home. More information on the details of our cure and all the creams that we tested, and all the details can be found at debugyourhealth.com if you click on the Phimosis tab.